Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex, to self-love, to questions about body parts. Let's get this episode started. These questions are all about sexually transmitted infections, or STIs. They used to be called STDs, or sexually transmitted diseases, but we changed the name over the course of years because they're not necessarily diseases, they're infections, and many of them can be treated. So, same deal though, STDs, STIs. Alright, question number 1. A year ago I was tested for gonorrhea and chlamydia, and I took antibiotics for it, which I assume means that you came out positive. Or they just gave you some prophylactically. Ever since then, my boyfriend and I have used condoms, but it seems like I have it again. My boyfriend never got tested, so could he have it and not know it? Heck yes. Generally, when we test someone for STIs and we give antibiotics, we give antibiotics for the partner as well, or arrange for them to get antibiotic treatment. If you were tested and they gave you antibiotics without knowing the results and it came back negative, then that may have been a situation where they didn't track down your partner and didn't recommend him taking antibiotics. That being said, it seems like you are only having intercourse with your partner. Are you sure your partner's only having intercourse with you? It would be a great idea for both of you to get STI testing. If you have gonorrhea or chlamydia again, or if you have it for the first time, it can, if you leave it untreated, lead to many bigger problems in your reproductive system. So it can cause scarring and problems with fertility or the ability to make a baby down the road. It can cause really bad infections in your abdominal cavity, so in the gut area, but it's a great idea for both of you to get tested and both of you to get treated. If you test positive, we also generally recommend retesting after 3 months to make sure that infection is gone. So those are a few things to keep in mind. Right now, what I would tell you, go get tested, have your partner get tested, don't have intercourse for a week until you know that everything is in the clear, or if you've both been treated, you should wait a week to have intercourse again. I hope that helps. Question number 2. Can you get an STI from touching something that one person with an STI touched? For example, if Max's penis touched a towel and then the towel touched Sam's vagina, can Sam get an STI, or does it have to be private area to private area? There are a lot of urban legends about infections living on toilet seats or on towels or on toilet paper, all sorts of urban legends that really aren't true. Sexually transmitted infections really do have to transmit sexually. So that's the way they spread. They do need that skin-to-skin contact, and unless you were to touch an STI and place it directly into your vagina, I don't know, that would be the only case. So don't worry about it. Towels, any non-skin surface, it won't survive on that surface and it will die. So you can't get an infection from toilet seats or towels or whatever else you're worried about. Question number 3. My labia majora has a little bit of a slightly red, raised, dry patch of white skin on it, and it won't go away. I also have this on my eyebrows and behind my ears. Could this be an STD spread to my face? That is very unlikely. In fact, what it sounds like is more of a skin condition, like psoriasis or eczema. It's probably more psoriasis, but it could be eczema. But that's going to be red patches of the skin that come with some white flaky stuff on top of them, and they can affect lots of parts of the body. Eyebrows, scalp, behind the ears, other parts of your arms and legs, and the private area. So what I would recommend is you don't necessarily have to show your doctor your private area. It would be helpful, but you don't have to. Show them the other parts of your skin though that are erupting, and there's a medication for it. I would definitely talk to your doctor about this, but it doesn't sound like an STD or an STI. It is probably a skin condition. Totally fine and fixable. All right, question number 4. Am I still going to pass on HSV-1 if I don't actually have a cold sore present and have not had one in many years? So this is an interesting question. So there are 2 main types of herpes, and the herpes simplex virus is abbreviated HSV. So type 1 is generally cold sores. Type 2 is generally genital herpes. It's also important to know though that HSV-1 can be transmitted to the private area, so the genitals, and HSV-2, the typically genital HSV variant, can be transmitted to the mouth. So, to answer your question, either type of herpes technically can be transmitted even if you don't have a lesion present because of something called viral shedding. And basically the virus is living on your skin and can sort of slough off. Realistically speaking, with your cold sore, the chance of you transmitting it without it being present, or without you even getting that pre-cold sore tingling sensation, the chance is very low that you would transmit it, but it's not 0. It's also important to know that viral shedding happens with the genital variant, so HSV-2. Studies have shown that by taking a suppressive medication, meaning you take a medicine that prevents outbreaks of herpes, studies have shown that when you take a medicine to prevent outbreaks, that actually reduces your risk of transmission even more. So again, to address your question specifically, if you don't have a cold sore present, will you pass it on? It's unlikely, but it's still possible. And then to add to your question, when it comes to type 2, using barrier protection can help reduce risk of transmission, although it's not 100%. And taking a suppression medicine will definitely help prevent transmission to a partner. So just a couple of rules of thumb. Question number 5. I haven't been sexually active for about a year. I got home tested and all came back negative. Great. I had a small bump come out inside of my vagina at the opening. I thought it was prolapse, but it turns out that it was nothing. Okay. But a couple of months ago, I started getting lumps or sores on that bump, which is inside the vagina. It's only itchy when I touch it. Does this sound like genital warts? Okay, a couple of terms to break down here. So, first of all, the bump inside the vagina, so the first one, it's possible that that was a swollen gland or cyst, or likely a Bartholin gland cyst if it was toward the opening of the vagina. That can happen for any number of reasons, whether you're sexually active or not. That gland that usually produces mucus just gets plugged up, gets big, and feels like a big hard bump. You're concerned about prolapse. So prolapse is when anything, this is going to sound weird, but anything kind of falls into the vagina. So that could be your uterus, it can be your bladder, which is in front of the vagina, and it can be your rectum, or your gut, which is behind the vagina. This usually happens after childbirth, or when someone gets older, those muscles in the vagina kind of loosen, but you had it checked out, it doesn't sound like that's what this is, which is great. So that's prolapse. Now, again, I said the bump inside your vagina could have been a Bartholin gland cyst. As far as the lumps on the bump, so it could be 2 things. Lumps or sores on that bump could be that Bartholin gland or that cyst hasn't opened up yet, and it's still got some gunk in there that's causing an infection and festering, and can certainly cause some abnormal things to appear on the surface. And so that would be one possibility, is that it is a Bartholin gland cyst that has not opened up and maybe has become infected, in which case I would see a doctor. The second thing it could be is warts. It's quite possible. Don't panic. It's nothing to worry about, but again, it's worth seeing a doctor to have those checked out. Warts can appear anywhere in the private area, including on the inside of the vagina, and they usually appear kind of like, they're like warts and like little clusters. They describe it sometimes like as a cauliflower head. So if you've eaten cauliflower, kind of like a cauliflower head. Can be itchy, although sometimes they have no symptoms at all. So again, I would suggest visiting your doctor. Nothing to be ashamed about. Lots of people get genital warts. It's also important to know that even though you were tested for sexually transmitted infections, HPV is not one that is tested in those home tests. HPV is generally only tested when you go visit a doctor and have a pap smear, and they take HPV samples from your cervix. Otherwise, the STI testing that's done routinely includes gonorrhea, chlamydia, trichomonas, those things that can be transmitted and treated very easily. So again, HPV is not included in that testing, and neither would herpes be included in that testing. So important to know what you're getting tested for. There you go. And that'll do it for this round of STI questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.